do have a PowerPoint this morning, so being logged in by phone is going to be useful, by phone and by computer is going to be useful for you this morning. So we've asked folks to sign in by entering your name and organization in the chat box so that we have a roster. We know there are a couple of technology pieces that might be barriers, so if I do not read out your name, we'll have you share who you are right at the end here. So with getting started, presenting today, this is Jill Hoiting from Supporting Families Together Association, and I'm here with
Dave Edie with the Wisconsin Council on Children and Families. Happy Valentine's Day.
And Charlene, do you want to do a quick intro to you?
Sure. So Charlene Mouille from United Way of Wisconsin. Welcome, everybody.
All right, and then it looks like we are joined by a number of folks across the state. So we have Sabrina from Family Connections of Southwest Wisconsin. We have Kelly McClurg from SFTA. Here in the room with us we have Eric Larson, also from SFTA. We have Terry Schultz from Family Connections in Sheboygan, Audra Weiser from The Parenting Place, Sarah Enman from Brown County United Way, Suzanne from United Way, Fox Cities, Paula Breeze from Family and Child Care Resources of NEW, Jeremy Simon from United Way of Greater Milwaukee and Waukesha County. I think that I also see on the list and heard maybe Jackie Strand and Kathy Mullally from Northwest Connection Family Resources. And who else has not had a chance to enter their name in the chat box so far? We'll just do a last call out to see who else is on the line with us.
Hey Jill, it's Jody in Madison.
Hi Jody.
Lisa Faldudo, Portage County United Way.
Good morning. Oh, and I see Carrie Strode, and Carrie, I believe, is with the United Way of Greater Chippewa Valley, maybe. I know Carrie from many different threads of our work over the last several years, so good to have you on the phone, Carrie.
These shoes to somebody who bought them on eBay.
Oh. All right, and then I'm going to ask that folks mute themselves if they can. If we get background noise, we will end up muting on our end and then opening back up for questions, but I like to leave that open in case people do have questions throughout the webinar so we can address them in real time. I would also say we can use the chat box to post questions as well. I will try my best to keep an eye on those throughout the time we are together. So without further ado, we'll move on in our webinar. So we are through introductions, but wanted to have a chance to say a little bit more about the organizations who have contributed to the webinar this morning. So as I said, I'm from Supporting Families Together Association. We're the statewide association for child care resource and referral agencies, as well as family resource centers. So our goal is really to bridge those early childhood initiatives between that serve families and that serve early educators. So that's a little tiny bit about SFTA. Charlene, do you want to give a little intro to United Way?
Sure. United Way of Wisconsin is the state association for the 41 United Ways here. We are excited to partner with Wisconsin Council on Children and Families and SFTA on this Advocacy Day. And United Ways in general are fighting for education, financial stability, and health of all people in their communities.
And Dave?
Wisconsin Council on Children and Families. I'm the Early Education Policy Analyst. Actually, there's another with us. Dahi is with us as well, but he's not here today. The Council's been operating for 136 years. I was there at the founding. And what we focus on research, analysis, and advocacy for children and families.
So that's a little bit about the 3 organizations that are kind of coming together. Of course, this is all being made possible and has been planned with members from each of the organizations. So I just want to give a shout out to folks across the state who've helped to plan so far, and for all of you guys who are attending today to prep for Advocacy Day 2017. As I mentioned before, we were trying to be intentional to kind of build a common ground for knowledge and readiness for that Advocacy Day. We'll be coming together across the state to advocate around early childhood issues. And that kind of leads us into the why the ECAC recommendations. And this came about because there was such nice alignment between the work that SFTA and our members do, as well as the United Ways of Wisconsin and their members, because there is so much commonality around early childhood being seen as this prime opportunity for leveraging a return on investment, making sure we're reaching kids early so that all of the impact can be seen throughout the rest of their childhood and their lives. So those were some of the common ground pieces. The other neat thing about the ECAC recommendations, which we're going to get into, is they all build on an existing infrastructure. So we have something to go from versus proposing something completely new. So that from my perspective is a little bit on why the ECAC recommendations, and I'll turn over to Charlene and Dave to also give their input.
The ECAC, should we start walking through, or?
Sure.
Okay. It's the Governor's Early Childhood Advisory Council, so the Governor appoints each of those members, and they're all vetted fairly carefully. The mission is to help ensure that all children and families have access to quality early childhood programs and services. So I think most of these organizations that are here have that same goal. It's chaired by the Secretary of the Department of Children and Families, Eloise Anderson, and Superintendent of Wisconsin Department of Public Instruction, Tony Evers. There are about 25 members. Several departments in state government have members there. There are business people. There are many people from education, both higher education, and many people from associations that work with children. So it's a fairly broad. When in the beginning for the ECAC, there was a major needs assessment, and that took about a year. And so we looked at all the data, and we did a lot of we had a lot of groups that were studying different issues, and we have eventually created a structure with a goal that every child will be healthy, nurtured, safe, and successful. And we broke it into 3 particular outcomes we'd focus on: safe and healthy children, stable and nurturing families, and quality early learning. The council had, it's part of in the first few years there was federal funding, and they set up things that we should do. They wanted comprehensive needs assessment. They wanted to bring agencies together from across state government and to see if they can work with federal and state issues. They had a particular focus on child care and early education and on professional development. So after a few years of working on this, about 3 years ago, the ECAC said we are a recommendation group to the governor, and we'd sent reports to the governor, and we agreed that we should send top priorities to the governor for him to consider. So I think we've done a pretty good job. In the last couple of years, we ended up with 3 top recommendations for the governor. The governor and his staff have looked at all of this, and we'll talk about what each of those are as we go along.
And one thing I will, and Dave might be alluding to this in just a minute, but I think the cool opportunity today is that we have folks on the phone with us, all of you guys out across the state who are involved in each one of these recommendations in some way, shape, or form. You may be involved in just one, you may be involved in 2. I'm betting there are a couple that are involved in all 3. So it's a really neat way to also connect and hear your feedback too, which we'll have time both at the end, but if you have burning questions, feel free to use that chat box to ask them or chime in.
So that we'll call it ECAC, so you don't have to say all the words. But ECAC, what you're looking at, if it's in front of you on your screen, was the front page of what went to the governor. We wanted to put out interesting information about the importance of early childhood, and you can look at that as you want to, but talked about early childhood as an issue, as an economic issue. It's something that voters are interested in, and it's something that business sector is interested in. What the group decided to do was to come up with 3 smart investments. And we thought that talking about investments and talking about putting money into something that has a solid return was important, and that more and more state government wants to know what's the evidence here, what do we gain from this. So I'll start with the first smart investment on that's about Youngstar, and then others will talk about the other 2. Youngstar is somewhat complicated, and so is Wisconsin Shares, that is highly connected to it, the Wisconsin Shares subsidy program for low-income families. We decided we would have a clear and simple objective, was simply to double the number of children in high-quality child care programs rated 4 or 5-star under Youngstar. I think most of you know about Youngstar, but we'll talk a little bit about that for those of you who are not. But it seemed to grab people that it's a simple thing. You just want children, and particularly I think people were thinking about children from low-income families, but it was available to everybody where programs want to be part of Youngstar. So why don't we walk through, am I in the right place here? Yeah. Why did Youngstar come about? I think we wanted high impact. We wanted decades of research was showing us that short and long-term benefits came from high-quality care and education. And every day I am seeing more research that says that the impact of high quality for children, particularly those who are in low-income settings, has a remarkable impact. We also thought that Youngstar would help families know how to pick what kind of program that their children were going to. And what Youngstar does is the 5-star system makes it pretty clear to them how that works. And so the 5-star starts with a 1-star. If you're 1-star, you're out of compliance and you can't get reimbursement, and you're really not part of Youngstar. But it sends a message to parents that this is a program that has problems. An awful lot of those end up not being operating anymore. Not too many now. It was earlier. There are quite a few. It's getting better. 2-star is basically people who didn't change anything. We didn't force anyone to go through the whole Youngstar process if they didn't want to, but they get a 2-star, and they don't get the same amount of money from Wisconsin Shares. There's a 5% cut. It's been somewhat controversial. So some people think it's a good incentive, and some people think it's keeping them from moving. 3-star would just get, they wouldn't get more money, but they would meet some higher standards. In the initial Youngstar, there was going to be a 5% increase, but that dropped out early in the legislature. So 4 and 5-star, which take a lot for programs to meet in terms of high quality programs, get a 10% increase in a subsidy payment and a 25% increase of 5-star at 5-star. If they have children who are getting subsidies from Wisconsin Shares, they get more money if they're in 4 or 5-star. Unfortunately, the rates for Wisconsin Shares have been on the downslide, and it's not as useful as it has been, but at least we have it. There are 4 areas that Youngstar looks at for quality: staff education and training, learning environment and curriculum, business and professional practices, and health and well-being. The state spent a lot of time looking at other states and what they did and where the most research has been done, and tried to focus on those things. So Youngstar has all kinds of supports, technical consultation, microgrants, on-site rating that helps them know where they're at. And also, there's some challenges to increasing star ratings. Educational requirements seems to be the biggest block for many teachers and staff. Staff turnover is a problem, and staff compensation and benefits are all a big challenge to the child care world right now. There's been quite a bit of change since Youngstar. I think it was fully implemented around 2012.
With the school age track, yep.
Right. So what we see now, that 17% of programs are rated 4 or 5. About 5 years ago, that was at 8%. So it's almost doubled. So we've seen a lot of progress. 23% of children enrolled in Wisconsin Shares attend 4 or 5-star rated programs. And they were at about 15% at 4 years. And we're talking here about the number of children that are in Wisconsin Shares is about 46,000 children. So that is a big group that can be impacted by this. We would like to see, that's why we wanted a lot more kids in 4 and 5-star, and that's where the ECAC was at. The strategy was to improve the quality rating by giving a grant directly to the program. To subsidy did it child by child. In a lot of programs, there's only 5 or 10 or 15% that are subsidy children. We wanted to support any programs that want to get to 4 or 5-star and stay there. So there's a grant to get there, and there was a grant to help sustain them when they're there. And if you can see on the next screen, that there were quality grants and quality sustainability grants, and about 10 million annually is what we were asking for to do to move the quality. 10 million sounds like a lot of money, but it's a small fraction of the whole subsidy program. I think it's about 4% or 5% of the subsidy cost. So that's where we are. I will tell you that I've looked at the governor's budget. I don't see this there. It looks like the funding for quality child care is pretty much stagnant with a very slight 1% increase. So we're going to have to work with what we've got, but we'd like to fight to see if we can get some of this moving by the end of the budget.
And I think from the field, what we're hearing is that this, by investing larger amounts, so I know you saw previously on the slide that microgrants are part of Youngstar. Those microgrants are pretty small in nature. They range from $250 to $1,000. So not a microgrant that can do great things for materials or one-time investments, kind of type things that programs need, professional development, that sort of thing, but they are not talking the size that could really help a program change how they're compensating staff, how they are creating benefits for staff to retain them, and that was part of the logic behind creating these quality advancement and sustainability grants, that once they've achieved it, they can also sustain it, because we know with that staff education being such a high quality or a big requirement for advancing in Youngstar, they have the chance to get their staff there and then lose them to other systems that pay better, or yeah, well, quite a number of outcomes there. So that was really the some of the logic behind looking at these larger grants too.
Right. Yeah, I think that I know that the department with Race to the Top federal money did something like this during the last 2 or 3 years, not as big as we were asking for, but they told us that providers were really excited about it, even though they were modest grants. My sense, I mean, I've been in the child care world for a long time, and by and large, people really want to meet high quality if they can. And they're really, one of the great things about Youngstar is that child care programs all over the state are trying to improve their quality and talking about quality and seeing what they can afford to do to move. And sometimes just a little bit of incentive gets them moving. This would be a big incentive, and we hope that it gets through at some point.
Absolutely. All right, so we're moving into the next smart investment. We will have time for lots of questions at the end. We'll make sure we get to cover all 3 investments unless someone has a critical question. In words, not always simple to move forward in implementation.
Yeah, let me just say that there were about 6 or 7 groups that were putting together proposals, and we were on the same team, and we came up with the same, double the numbers.
Yes, we did.
And it was much simpler than what other people put out, and I think that's why we won.
Yeah, I think so too. I think folks have heard of home visiting before, but I wanted to take a moment to just make sure we're all on the same page about what are evidence-based home visiting programs. So all evidence-based models, they provide voluntary home-based services to families with young children, but they really differ in respect to whom they reach and what services they're providing. I do want to give a shout out. the national web pages for home visiting and for the maternal, infant, early childhood home visiting program, as well as Home V, which is kind of the entity that evaluates home visiting models. They are great resources. So if you want to dive really deep into these models and understand them more, that's the place to go. We're not going to have time to cover all of that today. But a little bit more on the models. Most models target parents or children with particular risk factors. So that could be low income, it could be first-time moms, it could be teen parents, or it could be children who might have developmental concerns that they're exhibiting. Some models allow mothers to enroll prenatally, while others provide services after birth. Or based on a child's age. They may provide services for a year, or they may continue based on need or until a child reaches a certain age. The goals of each model vary, and they do include improving child and parental health, addressing school readiness, fostering healthy child development, and improving family self-sufficiency. And then the activities also vary within different models. And they're informed by the goals of that model. So examples of those activities might be parent education, referrals to community resources, activities to support and encourage parent-child interaction, and screenings for parents and children to identify other potential risks and connect them with the supports to ensure that resilience. The other piece that varies is the frequency of visits. Some models may have it weekly, others may have it every other week. Those are the most two common ones, but the frequency really does change. So nationally, there are a number of models that are increasing their evidence. As of now, there are 17 evidence-based models that are eligible to be used if you're using McV funds. And so McV funds, I'll get into this a little bit more, but that is a significant portion of the Family Foundation's funding here in Wisconsin. And in Wisconsin, we're currently using about 5 evidence-based models, and we'll get more into that as well. So when we think about high impact, evidence-based home visiting has very similar rationale and strong arguments as Youngstar. There have been a lot of studies around evidence-based home visiting, and that they are very promising in terms of producing outcomes that reduce the number of low birth weights in babies, the reduction of child abuse and neglect rates. This one's a big one. It can be up to 50% reduction of that risk. Improvements in school achievement, and increased graduation rates. So in terms of return on investment, there is evidence that home-based or home visiting can have a return of up to $5.70 for every dollar invested. Again, these are big picture returns. When we're thinking about this early intervention, it's producing many different outcomes on the far end, so things like reducing the need for child welfare services and costs associated with it, special education, higher retentions and grades as we go along, tied to that increased graduation rates, and then that reduction in the need for juvenile justice services. So a little bit more background about here in Wisconsin. So we know that there are a significant number of programs that are using evidence-based home visiting models in Wisconsin. We have created a directory in collaboration with a number of folks across the state so that we can keep a good tab on who's offering these services and how do we connect families to them. So our latest number is just over 80 programs. Now, the important thing to remember here is that of those 80, only 14 are grantees who receive funding through family foundations. And so why that's important is that Family Foundations offers a system for the evidence-based home visiting models that create this statewide ability to provide similar services. So when we think about the remaining programs, they may be locally funded. They may be connected to the national model advisory committees that do exist in the state. So that's primarily for Healthy Families America or Parents as Teachers. But the supports that they have access to vary in comparison to what grantees through Family Foundations have access to. So that's why there's a lot to be said for investing in this statewide system, because it strengthens some of those low local programs in really meaningful ways. When I say that, though, I don't want to discount anything that's happening locally, because those programs have made this happen without a solid funding stream. They have pieced it together, which is amazing. So the graph to the right breaks down where we see across the 5 evidence-based home visiting models we see in Wisconsin. That gives a sense for the breakdown. One thing that's interesting is Parents Teachers does have 3 different types, essentially, of users. Some are full-on affiliates that are using the model to fidelity. Others are curriculum users. A lot of it's associated with cost and what programs can afford to do. That is a major component when we're thinking about funding, is that evidence-based home visiting models have a lot of requirements for fidelity. You know, we talk about the cost on Youngstar and how much it costs providers to be reaching these standards and quality. It's a very similar thing on home visiting, that there's a lot of requirements that go with it and a lot of professional development that staff need. And so those are really important aspects of that investment. So moving into a little more background, people are very curious, like, where does the money come from for home visiting? And so currently there's $8.65 million in federal funding coming from that maternal, infant, early childhood home visiting program. It's important to know that a cut was experienced at the federal level. They started to relook at how they were allocating funds. It had been competitive grants, is my understanding, and then it became a formula grant that did impact Wisconsin. Wisconsin had done very well in these competitive grants, so that resulted in a cut. And then, of course, as part of that change, there was also required to have an RFP at the state level process. So this then had impacts going down to the local programs on which programs were funded, to what extent they were funded. So that has all happened in about the last year, a little over a year. So a lot of changes have happened there, and that has impacts on a number. In some ways, new families have access to services. In other ways, some families have lost access. There may be new startup funds for new programs where they're needing to invest in staff. So there's lots of considerations there. There's also a small amount that is used from TANF towards home visiting, and then another small amount from general revenue that has been the same for decades, is my understanding. So the really, really great news on the home visiting front is that the governor's budget proposes an annual increase of $3.9 million, so $3.9 million each year in this biennium. So that helps to address the cut that was mentioned above from the federal process, and it offers a little extra. It's not a huge amount that is extra, and I think that will be where the department, when they released that RFP, I think they were thinking already that they're not going to do another RFP, but now they have folks who applied, and that will be a starting place of how to use those funds. So I think the departments will have quite a number of things to be working out if that is approved by the legislature. So that's kind of the next hurdle. The governor's put it in, now the legislature would have to approve it with the budget bill. All right, so in terms of strategies, this is a 3-pronged approach. So initially that focus of any additional funding would provide increased funding to existing family foundations home visiting programs, allowing those established programs to serve additional families. The next focus would assist on non-state supported programs, because there is a lot that goes into meeting those credentials, as I mentioned before. That can take a lot of time, need a lot of technical assistance. So by supporting programs who want to use an evidence-based home visiting model, may have the funds to do so, but need support in meeting the requirements, that is where this strategy would come into play. And of course, because with more programs using evidence-based models, there's more likelihood to reach more families. And then that third and final piece looks at establishing new evidence-based home visiting programs in underserved and high-need communities. All right, and so this, I had to really work on the wording around the investment. So when you see the chart from the investment paper, you'll see that it looks at each year allocation. It's an additional $2,500,000 that's being recommended. So that does compound. So it's meant to be like, so if we added $2.5 million in the first year, then the second year it's essentially $5 million from that starting point and above. Keeping going for 4 years so that it reaches a place that it could truly double the number of children being served by home visiting models.
Right. I'm on the steering committee for the ECAC, the Governor's Council. I was there yesterday, and we were having a celebration because it's not every day that the governor takes on. He's got hundreds of people, of organizations that are trying to get him to do something. So we think it's pretty great that the first time we put serious recommendations to him that at least one of them is picked up with him. Not the whole thing maybe, but it's a big step forward. And just think about where home visiting would be if it were just not going anywhere. Mm-hmm. This is going to help fill the hole and start moving in a positive direction.
All right, and now this takes us to our third smart investment, which I know many of folks who are on the call are quite involved in this. So this is getting at SEAT. So SEAT is a network that SEAT stands for the Children Empowered Through Education. And it is the network of public-private partnerships throughout the state. So SEAT also is a band of badgers, if you will. So multiple meanings in that. So the third smart investment is looking at expanding the SEAT and we'll get to those strategies. So first, a couple of things on why it's important. So high impact. We've already seen local communities in Wisconsin have significant outcomes in being able to increase the private investment in early childhood. So just a couple of examples are listed here, both with the Community Early Learning Center of the Fox Valley and the Community Partnership for Children of Brown County. So many other communities out there are really making a lot of progress as well. When we look at this as a smart investment, the National Governors Association has backed this marriage of public leadership and the private sector and resources as a major opportunity and a win-win situation. So if folks have not had a chance, I highly recommend Googling SEAT Network Wisconsin, and you will find this website. The website is one of the state-level resources that has been built to be able to connect folks throughout the state, to be able to offer communities tools and resources when they are leveraging support for public and private partnerships. And now this is a screenshot, so I can't take you through all of the pieces, but there's opportunities to take a pledge for early childhood, connect to other pieces. I think if not already, a speakers bureau is meant to be a part of this. So it's still in progress and being built, but that is part of that state level work that each of the networks is contributing to. So as part of Race to the Top Early Learning Challenge through the Wisconsin Department of Children and Families, there was an RFP process as well, and grantees were selected for this public-private partnership work. And so each community offered up their own proposals and solutions to how to increase this private investment with these the public work. So first round grantees, and this is where I know there are many of you on the phone, and we'll have an opportunity for folks to chime in too. But you can see the first round grantees, and then there were 2 additional groups added as a second round of grantees as well. So in terms of the strategies that the ECAC put forth, that it would be, again, we're really into 3 prongs apparently at the ECAC, because we have another one of those here.
Holy Trinity.
Yes, there we go. with new grants. They'll be looking at local early childhood coalitions being able to apply for funds to assist them in building capacity to leverage those community resources. So really similar to those initial RFPs that, or the initial RFP that was released by DCF. So then also looking at supplemental support, so supplemental grants that would allow currently funded coalitions the opportunity to continue their work and to be more of a bridge between as they're becoming more self-sustaining and have that, that work all based locally. And then third, to being able to support an ongoing state-level infrastructure to provide tools and resources to local coalitions, for example, the marketing materials, the websites, all of those pieces. So I think one of the important things also in background was I recall early in Race to the Top when they were trying to wrap their heads around this public-private partnership piece, it was building off a lot of the work that I was not a part of in the past, but Dave, I know you have, of PWEs and other public-private partnership entities, but then also really taking into account local feedback and the idea is that there is so much local focus in Wisconsin. We love our local communities. So moving from one statewide public-private partnership to really having more grassroots efforts to local efforts or local level and keeping those funds produced there in local communities. That was a big piece of feedback, I think, that people, to feel successful in leveraging private funds, they need to be able to say, yep, and it's going to stay and benefit our community. All right, and then here you can see it would be an additional investment of $1 million annually, and you can see the breakout by those three, the three-pronged approach. All right, and Charlene, I know you have a number of members here who are involved with this, and that you had gotten a couple of more perspectives to add, so I will turn it over to you.
Yeah, I mean, from a United Way perspective, raising private dollars, I think this is very interesting and helps to support even the other work possibly that has been talked about and more. I think it would be good to hear from a couple of the folks that are on the phone to maybe give a little bit more context to what you're doing, knowing that we only have a couple minutes, but just so those that aren't familiar with what the actual work is could just get a better sense. Would that work? So you can call people out, but just like a 60-second, this is what we're focused on, and this is how this has helped us go to the next level.
Okay, this is Lisa Falduto from United Way of Portage County. We are a Race to the Top grantee. And our Race to the Top grant was a planning grant which led us to systems change work within our county. So what we're doing is looking at developing a screening tool that will screen risk factors in families and then offer them support through home visitation programs prenatally through the age of 5 within our county. So that's a little overview of what we're doing with our Race to the Top grant funding, and we now have secured another grant through the Medical College of Wisconsin to continue the systems change work. And I'll call out Brown County, huge thanks to them. They've been a wonderful support. They're doing something similar but are much, much further along than we are.
My name is Carissa Frank, United Way of Hoiting County, and we applied for the grant, but we weren't selected. But we're still going to those meetings, and again, Brown County really has helped us as well. And this past year, we actually have a Welcome Baby program started since November. So again, like you were talking about, connecting first-time families, we're starting out just like Brown County did with community resources, and then connecting families that qualify for home visiting as well.
Sarah or Jeremy?
Sure. So this is Sarah from Brown County United Way. We were one of the communities awarded Race to the Top dollars, and we're a part of SEAT. It's been a great experience going to the meetings, learning about what other communities are doing. Our specific dollars went to support our community information system, which is at the moment focusing on gathering data around early childhood and looking at some targeted outcomes within nonprofits and schools and healthcare systems. And so I was instrumental in helping to support that initiative, which ties directly into our early childhood work.
Looks like,
and we have oh, did you see that, Charlene?
Yep. So I was going to say Jeremy posted a note that they're using support to establish an infrastructure of sharing early childhood data as well. So I think, where this, this public-private partnership, we're very interested as United Ways because we feel that with some public investment, we're able to stretch private dollars further and sometimes explore avenues that wouldn't be as easily like the data structures without it. And it's critical to then, creating more deeper level impact in communities. I don't know, Jill, given the time, if we want to talk more about this or just to open up to kind of general questions.
Yeah, I think we're good to move forward on the general questions. So I know, Charlene, you were going to take this section.
So we have a couple of questions for those of you still on the call. In general, what questions do you have for us? And then also, what else do you need to feel up to speed on the ECAC recommendations in advance of April 18th? So you can either post to the chat box or unmute yourself and ask away. Or maybe Dave and Jill did such a fantastic job of covering it all.
This is, go ahead.
Go ahead, Dave.
Well, I just want to say that the governor's budget has been put out there, but there's a long stretch now where the legislature is thinking about what they want to see and what things they're going to adjust and where they might add money, take away money. I'm getting a sense that they're a little feistier than usual, and so it may be very important to advocate with your legislators and to help explain to them why this is so important. There are quite a few legislators I've been talking to. I've been met with just about everybody in joint finance. They're all empathetic, and they all not sure where the money's going to come from. But we'll see. I'm not getting a lot of people saying that doesn't make any sense. They all think it makes sense. They're just trying to figure out how the budget's going to work. But the more they hear from their constituents, the more likely some of these things can be increased or making some progress.
Right. And Dave, I want to ask a clarifying question. I just want to make sure I understood correctly. Of the 3 recommendations, the only recommendation that has dollars in the governor's budget is the second, the home visiting recommendation, correct?
That's right.
So it's really important. I mean, it's important to advocate for all 3, but it's really important to tell the types of stories and particularly information, give your legislators information on why home visiting is important in communities and what expanding it would do for people.
Right.
As well as the other 2, continuing to educate and look for opportunities there also.
Sure. I think different communities have different priorities, and they can emphasize that, but it'd be good if they talk about all 3 of them.
Right.
Yeah, I think that was one of the things as the ECAC was putting these together, having that concern of okay, when you put put forth 3 is the first thing that people are going to ask is, well, which one's most important?
Right.
And so where we can show this intersectionality between these 3 is so important. You know, home visiting, as we mentioned, it can be prenatal, it can be ongoing, but really focuses on that home setting. I really do emphasize the voluntary aspect to it, especially with our current legislature, that this is not anyone coming in and making these families do this. This is a support that families see value in as well. And that voluntary piece is big. But then also that prepares families and kids for going into early care and education settings. Which may happen earlier for some families, it may happen a little later for other families. It really depends on their situations, but we need to have a bridge in quality between those. When they've had amazing home experiences, we want them to also have amazing experiences in early education that focus on that quality and preparing children for later. And then, of course, that public-private partnership comes into play, and how do we make sure this is sustainable and that everyone has a stake in it. So I think there are really compelling ways to be able to talk about the 3 together, but that is an important message to be able to send.
Right. So a last call for questions or any other pieces of context that would be helpful from anyone on the call.
This is Suzanne. I do have a question. I just want to make sure I understand. So the Race to the Top funds that were used, or that, you know, where they use the RFP process, those are not, those were federal dollars, were they not?
Correct.
Right.
Yes, and they will be completely ending in 2017. At the end of 2017, all expenditures will have to be complete from the department.
So we would be looking for new dollars, or a new $1 million annually investment to continue this concept of the Children Empowered Through Education programming.
Yes.
Thanks.
Actually, most of the funding for all of these things are mostly federal. Probably most of the funding from the state are what they have to do to put out as match for the federal dollars. So I would guess that it's no more than 20% is state dollars. And
Okay.
I'm not sure about this. I think the 3.9 is going to come out of TANF, which is, again, a federal funding. I mean, we're happy to take federal funding where we think it's most needed, but there's a time where I want to say, hey, how about the state putting some state money? There are kids, there are families, but you know, it's a tough battle.
Yeah, and Dave brings an excellent point in terms of these 3 priorities could all be competing for that same federal funding stream, which makes it hard too, and that we have to keep that in mind when we're framing it to folks to say, no, we don't want this to be a competitive piece. Screen now. Also want to make sure everyone has received the registration flyer for Advocacy Day on April 18th. I did want to give just a brief overview since we have a few minutes. Dave is going to be a keynote speaker for us, so he is a wealth of knowledge and has even more history and components to share with us moving forward on that day. And then we're looking at having 2 breakout sessions for folks. We know that it's a spectrum of folks who are going to be joining us that day in terms of their comfort level and previous experience with advocacy. So we're looking at having 2 breakout sessions, one that will look more specifically at the legislative office process and having some guest speakers who have been in that receiving role of a legislative office visit. So past or present staffers, hoping to also make sure that it is bipartisan, so we hear lots of perspectives. The second breakout session, we're looking at having folks from some local health departments talk about their engagement in two of the efforts, early education and home visiting, and how they've used coalition building and other grassroots efforts to gain engagement in their advocacy efforts. So two different pronged approaches there. Then we'll have a lot of time, not a lot, so all you need to do is give us a little bit of information and we'll take care of it on our end. Then after legislative visits, we'll come back together to debrief as a group and hear how things went for one another. And from past experience, that's one of the exciting, I think people really like that debriefing session at the end. There gets to be a lot of energy going at that point. So that's just a little bit of a rundown of what we're anticipating for April 18th. We will be at Bethel Lutheran Church because that is a very quick jaunt up to the Capitol. It's a less than a 10-minute walk for folks, and we'll also have arrangements if anyone needs transportation. We will make that happen too. So. And
it will be sunny and warm now.
Right. Yes. April will be lovely. So any other questions there on the logistics or needs for Advocacy Day? All right, well, we will hope to also hear you for our next webinar. We have one more in preparation for Advocacy Day. It will be in learning a little bit more about partners' other initiatives to set the stage even a little bit more for Advocacy Day. It's going to be March 14th, same time, 10 to 11 a.m. And I will be sending out a reminder with the link as well in advance. I realized this morning that the registration flyer, the link was not working. So thank you for your patience as I got those links for this morning's webinar out to everybody. So I think that wraps up. Unless, oh, yep.
I just want to say one more thing. This is Charlene. I just want to thank Dave and Jill for taking the lion's share of this presentation and for all your knowledge on this topic and many more. Thank you.
Oh, thank you, Charlene.
Thank you.
We're happy to do it. So we will talk to everyone soon.